Okay. Um, Today is Thursday, March 28th. My name is Alissa Rae Funderburk. I'm the oral historian for the Margaret Walker Center, and I'm here on behalf of the Scott Ford Houses Incorporated to continue the Granny Midwives Oral History Project by interviewing Dr. Robert L. Smith. Dr. Smith, do I have your permission to record this interview?
Yes, you do.
Thank you very much. Can you please say and spell your name for the record?
I'm Robert Smith, MD. Robert Smith. Smith.
Thank you. And can I call you Dr. Smith?
Or Robert.
Or Robert?
Yeah.
Okay, great. Again, just for the record, can you tell us when and where you were born?
Yes, I was born in Terry, Mississippi, on December 20th, 1936.
Excellent. I understand your father, was his name Joe Smith?
Yeah, named Joe.
He was a farmer and a livestock dealer, is that correct?
Well, livestock dealer, farmer.
Okay.
Yeah, his principal income was from livestock trading and dealing. In fact, he worked with the full 9 yards, I guess, from granny midwife training from his father. He sometimes had to help animals give birth.
Oh, wow.
Yeah.
I didn't think of that, but that's probably really useful training.
Oh, absolutely, and it was also useful training in trading, and because he was called upon all over the county, and made his usefulness kind of interracial when it was not very popular, because in terms of farms, more white people had big farms than blacks. Although I was fortunate enough, or he was fortunate enough that where I was born and reared was really a conglomerate of black folks who owned farms and who kept those farms and have maintained much of that land through hard times.
That's impressive.
Huh?
That's very impressive.
Yes.
Yeah.
Mm.
And then can you tell me a little bit about your mother?
Well, it's interesting. I'm here, as a result of the subject in which we are to talk about. My father married a Matilda Owens, and in 1929, she died from childbirth. And my mother was actually in school with Jackson State, and she was living with the Brinkleys, for which Brinkley High School is named for. And I don't know, but somehow, well, I guess because of family connections, land, her parents had land in Terry. He ended up marrying her and taking her out of school. So she died from childbirth at home from bleeding. Yes. And married my mother. In fact, I was fortunate in this way, in a sense that my grandfather actually learned how to read and write and got in an argument with his boss coming out of slavery and hit the woods, and there was a train slowly moving through. He thought it was headed north, but it was headed south. and he ended up getting off in Terry, acquiring some land, working hard, and in fact, he built a plantation house similar to the master's house. He had 2 stories, a whole 9 yards, with, of course, a smokehouse and all the things that supports a plantation, like a grits mill and molasses mill and oak trees, pecan trees, fruit trees, the whole 9 yards. Yeah. And my father copied that. Now, I was just thumbing through my phone. I didn't grow up in a 2-story house. I didn't grow up in a house as big as he did. But I grew up in a 7 or 8 room house that's 100 years old that a tree just hit 6 months ago. And we're in the process of putting it back together now.
Wow.
Mm.
I hope that the repairs go very well.
Well, yeah, I'll show you. It looked unrepairable, but it's coming back.
Good.
Mm.
It's important to hold on to that
Yeah.
heritage.
Mm. Yes.
And what was your mother's name?
Mother's name was Wilma Porter Smith. Mm.
And
SWILMA Porter, PORTER Smith.
excellent. Thank you.
Mm.
And from what I've read, you're the 9th of 12 children?
That's correct.
So,
9th? No,
no?
that can't be right. Yeah, 9th of 12 children, that's correct.
Yeah.
Mm.
That's a lot of children.
Yeah.
Was that
6
common?
Well, yeah, 6 of them was by Matilda, and 6 of them was by my mother. I didn't know, however, that I grew up in a blended family. My mother reared us all as one family.
That's beautiful.
Yeah.
And can you tell me a little bit about your siblings?
Yes, my oldest sibling, Gladys, ended up marrying a young man, and it's amazing how you talk about sometimes separation of the black family for good. She married a man that was recruited by the Great Northerners to come to Minneapolis. You've heard of the sleeping car porters? Okay. Well, he was one of those. I was trying to think of this guy. I met him. He was a famous black guy who recruited black men, what they call handsome black men who became sleeping car porters, and he ended up working for the Northerners, the Great Northern out of Minneapolis, ran from Minneapolis to Washington, Portland, Oregon, and all of that. And they left Jackson, and she ended up going back to school and working for the school system in Minneapolis, and had one child that ended up getting a degree, and then I had the next 2 sisters, and she married into a prominent family here called the Coopers, who ran a place called Drummer's Corner. It's right next to the Kofo building. Yeah, that was a black business established area there. Yeah. And my oldest brother, who went into the Army and got a trade doing, learning how to put together washaterias, and came back and put together a series of washaterias in Jackson. One of them is still operating, on Ridgeway. And I had twin brothers who I think were the most successful ones of all because they stayed on the farm with my father, built twin homes, and reared successful families. And then on down, another brother who ended up joining my sister in Minneapolis and on down to me. Yeah. And then George, who was, along with Benny, was the first two blacks to elected to as Board of Supervisors here in Hinds County. And a baby brother who worked in the public schools of Hinds County. That was it.
Excellent.
Yeah.
Thank you for sharing that. I think families are very important.
Well, family is most important, and that's one of the reasons that I say that my twin brothers are most important. My family, my daddy, you didn't talk about sets of children. We grew up, although my mother was Bingham's Porter family, and his first wife was Owens, but we never knew the difference. We just did not know the difference. And the reason I talk so much about my twin brothers is they followed my daddy's footstep and helped him keep the farm together, and we always, on the weekend, regardless of where we may have been, we would always come to Terry for gathering. My mother's place was, my dad's place was like Piccadilly's on Sunday. it just flowed through different sets from church to time to go back to church that evening with food. I hear people tell stories about having to wait till the preacher eat. I don't know anything about that. You know, we were always fortunate enough to have a dining room table and a kitchen table and enough food and enough people around to serve everybody.
Well, with a family that big, you needed two tables.
Needed two tables and needed help, and I'm saying that we always had to help from family, immediate family, or extended family. Yeah. So we were just fortunate in light of that day and time.
I was wondering if you could tell me a little bit more about your father's first wife. You said she died in childbirth.
Yeah, she was attended by a midwife. At that time, I can't really speak to the fact of whether they had a doctor in Terry. By the time I came along, my family doctor was a Dr. Hugh Banks from Crystal Springs, and she was attended by a midwife, but was oversaw with Hugh Banks. Fortunately, my father was one of those few blacks, again, at that time, who had could afford, did pay for doctors to come out. And Crystal Springs was 8 or 9 miles from Terry, and he oversaw, I know, the last half of our births, along with having a midwife.
Along with a midwife? Along with a midwife.
And that was common. You know, I did some of that when I first came back. Really? I didn't want to do that, but that was just, when I first came back, I was what they call a GP. I later went back and became a diplomat of the American Board of Family Medicine, but when I first came back, I would get a house call, and guess what that house call may be?
Birthing a baby?
With a midwife. That is, I don't recommend that for anybody.
Why?
It's a scene that you don't never know how it's going to go, and you could never give especially in a first baby. You can never know. You could never give. We did what they call clip the vagina a little bit. Sometimes it helped the lady have the baby, but you was afraid to give too much sedation for the. It's just not a good scene, even if you trained. And by that time, for some reason, I wanted to go into OBGYN, and I started delivering babies when I was second year in medical school. I did what they call an externship. And at that time, Cook County was delivering more babies than any other hospital in the country. Black folk were leaving the cotton fields and coming to Chicago, and as soon as you could finish in one delivery room at Cook County, you go to another. In fact, last year, this is very interesting too. I had a lady who came from Terry who knew my family, and she said, brought me a picture of her grandson that I delivered. Now listen to what I'm telling you. This kid is 2 years ago was 66 or 67 years old. And she says, Dr. Smith, she says, I know you are probably 95 years old. She says, because you delivered my grandson, and showed me this birth certificate where I delivered this kid back in 1955. And she counted the years. But I was actually working as an extern, as a physician. And I started delivering babies back then, and every opportunity that I got, I used that opportunity to work the emergency rooms or work the delivery suite, and I was needed. Here again, very interesting. But when we talk about black morbidity statistics, you have to have, I ain't gonna say you have to have been in a situation like I came through to really understand and appreciate why the maternal and infant mortality rate for black infants and black children, black infants and mothers, out the roof, not only in Mississippi but in Chicago, because as an example, many of these women was just off the farm. None of them had, I ain't gonna say none of them, that's the wrong word to say none, but most didn't have any kind of prenatal care, or had no education about use of alcohol and tobacco. They would just show up in the emergency room. I was talking to a prominent lady last week here in Jackson whose now in a very prominent position. But where you think she was delivered? Cook County Hospital in Chicago.
And moved down here.
Well, times got better. She came back. We were talking about that. There was a great migration, and then some families, held together, kind of like my family. I was telling you that that land that we have in Terry has been in the family since the 1800s, late 1800s. And I guess all of not all, but my immediate family who went north ended up coming back to Mississippi. Yeah. And that's true of many families. The migration back. And she has been a part of that migration back in her family. But was born Cook County Hospital.
So, talking about Cook County, you said for some reason you decided to do OBGYN. Do you not recall what the reason was?
Yeah, well, I decided that not because of the situation that the experiences I had in my own family, but you tend to, once you get into medical school and you go through these different rotations, you tend to end up doing or traveling the direction in which you have the best grades, or you seem to be appreciated, or you seem to enjoy. And as I told you, starting really in high school, one of the most, I guess, tumultuous times I ever had in my life, or stressful times, or headwinds, is when I got ready to go to college. I told my parents that I was going to Chicago. And of course, my reasons for wanting to go to Chicago was I knew at that time, even at that time, I wanted to become a physician. And I had been told that you needed experiences working in a hospital. And the only way I could get experience working in a hospital in Mississippi would be working in the kitchen or in housekeeping. And so, of course, I was young too, and my parents didn't want me to do it, but I had a brother in Chicago, and I had money in the bank, and I took off and started working. Then I worked during the day, in the hospital, Chicago has the largest, probably one of the, well, I won't say now the largest, but they at that time had the largest medical center in the country. Chicago, Cook County had about 7 or 8 different hospitals, and the University of Chicago Medical School was in there, Loyola Medical School, the VA, and Chicago was the only city in the country that had 5 medical schools, and all of the medical schools had a service or services, medical services in Cook County. University of Chicago, Northwestern, and Loyola, and Chicago Med, and the University of Illinois were already in the medical center.
We're gonna pause, I think, for the camera to reset. But actually, my best friend went to medical school in New York, but did a residency in Chicago. She just graduated or finished last year.
Where?
She did Northwestern, and she also is an OBGYN.
Good. But I ended up doing it because I had that experience early on working at Cook County in OBGYN, and I was appreciated and I was needed. And so
I had staggered them. So
Oh, okay, great.
So but there was, of course, one reason or the other, there was always headwinds, and especially black. I was fortunate enough, facing headwinds, to be the first American black to get the residency at Cook County. But after getting that residency, the training spot, this is 61, the Berlin crisis, and that's something you may want to look up. The Berlin crisis came up. And guess what? My draft board in Mississippi says, no, you can't go forward. You're gonna come back to Mississippi and go in the Berlin crisis. But fortunately, two things happened at the same time. Again, three things happened at the same time. Came home and was prepared to go into service. At that point, didn't have an objection to going into service. Had looked forward to going into service. But found out it was because of racism. But anyway, I left training, came to Mississippi really at the right time. This was just before the height of the Civil Rights Movement in '62. Really nothing to do. Went home to Terry. All I had was a car, and some books, but and nothing to do. And the three things happened at once, and that was Adam Daniel Bidle, who was supportive of the students in the Civil Rights Movement, called me up and told me he heard that I was here, and asked me if I would provide some health services at Tougaloo. And I really didn't believe that. I was just, Tougaloo want me to come and provide health services? you follow me? I'm saying, oh God, I was just really excited, And then I guess I wasn't here a week, and I joined Medgar Evers. If you look back at my resume from Tougaloo, I was a member of the NACP, and they were having mass meetings. And I was like a king coming to town. Dr. Smith has come back and joined the mass meetings. You follow me? And of course, what a delight. What a delight to be home, and what a delight to be needed. And then the third thing all at the same time, Jaquith, who was considered a white liberal at that time, in a sense that although Mississippi State Hospital, the mental hospital in Whitfield, which is still there, at that time had probably 9,000 or 10,000 patients, invited me to come and provide medical services to the mentally challenged. And of course I said, what?
Yes.
Yes. That was the one that provided some money. I look back at it, you won't believe it, just a little over $4,000 a year. You can't hire a nurse for that now. Wait a minute. But going to Tougaloo on my off hours, going to work every day at Mississippi State Hospital, 2 weeks, and was going to mass meeting 2 or 3 times a week. And the beginning of the second week, perhaps no longer than the third week, I was leaving the gates of Tougaloo, and that's when the harassment started. I was forced out of my car and forced manhandled in the back of a Mississippi Highway Patrol car. And to the city jail I went. This is the beginning of the harassment, but the beginning of the appreciation and understanding of why I wanted and needed to be in Mississippi. There's some interview that talked about me saying that I was never coming to Mississippi. That is an incorrect. I have never intentionally said that, but I had not planned to come back then. I had planned to, complete my training and then come back to Mississippi. But I just wanted to put that out there. But we have gotten away from midwifery, but this is what brought me back here. And after later on, I was not really confronted at that time with midwifery, but after the next year, they shot and killed Megha, and I, along with 3 other physicians, that book that she was talking about, The Good Doctors, you see me leading the picket line, which brought attention nationally and linking the civil rights movement to what? Healthcare and the crisis, nationally and internationally, and brought when I got back home the next day, Highway Patrolman did the same thing again and took me to Jaquith. And of course, I was summarily fired, And that's when I made the decision to continue my work with civil rights and worked at Tougaloo and got introduced to live midwifery.
Yeah. So you'd mentioned earlier that making the house calls for, birthing babies with a midwife wasn't the scene.
Was what?
It wasn't a good scene, you said.
No, it wasn't a good scene, and I wasn't trained. See, at least my training in medical school was in a hospital, and even though I had worked and delivered by that time several thousand babies, it's never. It was with a team, and help if I needed it, and and back that time too, Mississippi was segregated as, you didn't have interactions here, and I'm going to wonder again, but. I can't, in this interview, talk about Mississippi from slavery, but let me tell you what happened in '55. Following the Supreme Court decision declaring it was separate but equal, the Citizen Council, of course, as you know, was formed in Greenville, which was doctors and lawyers, and and the storekeepers or the movers and shakers in every community. And in '57, the Sovereignty Commission, which was a paid agency to spy on everybody. And so people who wanted to do good, I mean, even white people who traditionally would have crossed over and would have been helpful in some of these situations, couldn't do that. Now, people get defensive, and particularly graduates of black institutions. All historical black institutions were liberating institutions who believed in human rights and pushed us all forward. But come in the 50s, that was shut down. If students or faculty members came out openly supporting integration, you got out of there. Ain't no doubt about it. It just didn't happen. And if you read Civil's book, The Closed Society, he talks a little bit about it, but don't go into detail on how, again, that separated the races and sent all of us back, and how that contributed to some of the statistics that we see today that relate specifically to black people.
Because of segregation, black people couldn't go to hospitals as much or have as much access, right, to doctors?
Absolutely. They couldn't have access, and what I'm saying to you, where HR is in Jackson State today, that was another thing that Aberdeen was able to do with my help, and that is get that a part of the historic alley at Jackson State. But that was a hospital. It had 2 wards, one black, one for females and one for males, and 2 private rooms and a delivery suite. And to get into that place, you had to pay at the door. Otherwise, you couldn't deliver there. You had to deliver at home. University, which delivered most babies, but here again, there was a required fee. And so Midwives delivered most black babies. Mm.
It makes sense. It's terrible, but something like the Sovereignty Commission scares you, right? That's the whole. It's terrorism.
It was terrorism, and that terrorism went on to the 70s until Waller became governor.
We did go off track just a little bit, so let me check my notes here. I'm curious, since we are talking about midwives and access to healthcare, if you can talk a little bit about what it was like in Terry. You mentioned that you guys had a family physician because your dad could afford to pay.
Right? Did pay.
He did.
I ain't gonna say could afford,
Yeah.
but he did pay. He did have the ability to pay.
Yes.
In fact, my dad many times was able to help neighbors because he had that reputation of paying. And many times the physician would come to our house and he would take them to a neighbor or a friend's house.
Yeah. But for folks who didn't have money or didn't have the help of your father, what was healthcare like for them?
Well, you know what healthcare was like. Healthcare was home remedies or no healthcare. As another example, when I came to town, many times people would call me for a house call because they knew that a doctor's signature on the death certificate was a requirement, and they would call you. And the patient would be laying over in bed, terminally ill, dehydrated, with none of the accoutrements or the ability to take them to the hospitals or get a lab or get x-ray. It was just unfortunate.
You mentioned being really excited to work at Tougaloo, to come back from Chicago and be asked to provide.
Well, imagine now, I've faced headwinds, and somehow got around those headwinds, accepted into one of the most cherished residencies in the country, and looking forward to completing that residency. And all of a sudden, you get a notice from your draft board to come home. Okay, you got nothing to do. I'm sitting at home, and imagine President Jackson State. Imagine him calling me and saying, "Robert, would you come and help us with health care at the college or some other institution like that, or Jake with?" Oh, it was just delighted. It was like a gift. It was a gift. It was an opportunity.
Yeah. I brought it up because earlier you mentioned the reason for, doing OBGYN was you saw that you were appreciated, that you were needed. And it seems like Tougaloo needed you, and they appreciated what you had to offer.
Absolutely.
And I'm just wondering.
You must remember now, I was servicing. By the time I came back, and again, you have to look at, there were only about 15 physicians in the whole state who was active, doing some kind of active practice. Maybe 50 total. But that other 25 or 30 was my age then. They, cut back or just was worn out, beaten. System had beaten them down. It never allowed them to become a member of the AMA, the American Medical Association, or to have a hospital privilege at St. Dominic's or a Baptist. Of course, at that time, Heinz General, or what we call Merit, didn't exist, but in a major hospital. Imagine you, a physician who wanted to become a physician all of your life and ended up in Mississippi. At that time, your privilege was at Jackson State. If you was here in Jackson, if you was in the Delta, you was at Afro-American Hospital in Yazoo City. Or if you were in Mount Bayou, you worked at Taborian. These were all black hospitals that just did not come up to the standard of your major hospitals back then.
Not to mention, they're not big enough for all of the people who need health care.
Absolutely. And black people had no way of paying for health care. absolutely no way. One of the major contributions that I was able to make as a result of being here at that time and linking healthcare to the civil rights movement was to become the Southern Field Medical Director for the Medical Committee for Human Rights, and the Southern and we provided the health care for the civil rights workers, their families, and people who could not get appropriate health care during that period. You got punished for conducting voting rights meetings and all that kind of stuff. It just seems inhuman, but it was real. Well, anyway, at the end of Freedom Summer, 5 of us met. Jack Geiger, who had been a science writer and had traveled many parts of the world, and was in the last year of a epidemiology residency at Harvard, and Count Gibson, who was a volunteer, was chairman of community medicine at Tufts, and we had an institution, and myself from Mississippi put together a proposal for the Office of Economic Opportunity. Of course, you know the Office of Economic Opportunity was put in place by Johnson to address this gap that Martin Luther King in particular and the other 4 leaders of the 4 major civil rights organizations has called for, and that is opportunities for the least of these to close that gap. And you can see what happened. But nevertheless, we put that proposal on Shriver's office in 1965 and came up with the idea of health centers, and it was funded for 2 centers. And today, that provide health care for 34 million Americans, over 300,000 in Mississippi, with over 1 million visits, with 22 centers in the state. And the other thing it has brought back, hundreds of providers and workers. And of course, we still have not expanded Medicaid. There are still 700-800 Mississippians who can't afford the least of it, a modicum of health care. They don't make the money.
Right. I'm thinking about starting these healthcare centers, like having the idea to start these healthcare centers, because you couldn't get privileges at hospitals, and obviously Black folks, poor folks, needed somewhere they could go because there weren't enough doctors to make all the house calls that there seemed to needed, because it's an impossible situation.
Absolutely. Absolutely. And this has not been a long time ago, and people still don't realize that there are still people who fall through the gap. Mm-hmm. We've come a long ways, but we still have a long way to go.
Yeah. And thinking about your experience in delivering babies, your experience in doing house calls to deliver babies, I'm curious if you can speak to kind of that transition from most Black babies being born at home, being born with midwives or a doctor and a midwife, to actually being born in hospitals. Like, what happens to the midwives? What
Well-
happens to the mothers?
Well, finally, Mississippi finally came up. Let me go back and pay tribute to Albertine Harrison for starting this important project that hopefully will preserve the history of midwives. But here again, midwifery in Mississippi was a little bit different from midwifery in many parts of the country. It was sponsored by mainstream healthcare institutions. Unfortunately, in Mississippi, it was by midwives training midwives, and they did not get the support and did not get all the training they had until, I guess, Mississippi put in a program starting late 50s, early 60s. And Frida Bush was one of the first ones that I can recall that was trained in that program. And later on, Catholic Charities started a program in the Delta, and the Black Nurses Association and Lives of Pillars. These organizations were suppressed. These are when I had talked about the suppression of mainstream organizations who really would have been helpful had the system not have been so divisive as it had been in discouraging and punishing people for trying to do the right thing. But the most important thing that happened that really changed things was 65, in addition to health centers. I was a part of that group of physicians who was invited to White House Conference on Health in 65 to give Johnson the political support that he needed to enact Medicare and Medicaid. And then 66, RMP, the support that he needed to give support for health care, to bring the advances of health care in heart cancer, stroke, and later renal diseases to the local communities. And that money still is in effect today. But the most important thing that happened here in Mississippi was, of course, Marion Wright Edelman. Do you remember her?
No.
Marion Wright Edelman was a young black female who went to Spelman and got a law degree and was the first female lawyer certified here, and volunteered and working with us in 67, she got the statistics that we had gotten out of the Head Start program about infants, children, and the lack of health care among children, and called a congressional hearing with Bobby Kennedy. And tons of monies came to the state for maternal and infant health, which improved things a great deal. And wherever money goes, hospitals and other institutions and organizations will put in programs, and that has helped a great deal to improve statistics. But even today, despite all of that money, for some reason, we still have a higher infant and maternal health problems in the state, and black women all over the country.
Yeah. I, okay.
I want to check his mic on this one.
Okay.
In the 60s, mentioning black women, but many times not only that they didn't have hospitals to go to, but delivered babies in the cotton fields.
Really?
Oh yeah, that's recorded. You know.
So I'm just trying to imagine the difference between, you know, even now delivering a baby in a hospital can be deadly, right? You never know what's going to happen. You have all the help you can possibly have, and still sometimes things go wrong. So to hear you say that women were delivering babies in cotton fields, you know, and midwives were delivering babies in people's homes, like you said, that wasn't a good scene. Were you scared?
Absolutely, I'm telling you, I was scared. In fact, one of the most scariest scenes I saw one time is the lady couldn't, she had, the bed wasn't a good mattress, you know. They were a cotton mattress, and she would sink down in the mattress. And she told the woman, says, "Oh, I know what to do." She turned a straight chair upside down and put her across the damn chair. Yeah. And, it was, but she had the baby. The important thing is she had the baby. But can you imagine that?
I
Yeah.
can. I can.
Yeah.
I know so many black women who are fearful of getting pregnant, of having miscarriages, of having accidents in the hospital.
These stories have been told to them about their mother or their grandmother. You know, this is all in my lifetime.
Yeah. And just as scary as it is for women to go through childbirth, and as scary as it was for you to be responsible, right, in those homes, I'm also thinking of how terrifying it must have been to also be watched by the Sovereignty Committee or the Citizens Council.
Yeah, think about me now. Think about me. All I'm trying to do, think about me now, harassment. Think about me. All I'm trying to do is provide health care. Really, I don't have any talent. I can't play basketball. I can't play music. I've spent my whole career trying to become a physician. And I end up in the Sovereignty Commission file. Is that crazy?
Yeah.
You know, because I believe that that health is a human right, you know, I end up being called communist.
Mm-hmm.
Is that crazy?
It is.
Really and truly, I sometimes want to know what the hell I'd have done if I had not going into healthcare, because, I didn't have any, I can't sing.
You and me either.
Yeah, so it's very interesting, and all I was trying to do was what? Answer call when people needed me, and felt gratified to, at least if I could not do it, have enough background and training to provide them with an avenue to get help.
Right. Just even to tell them what's wrong, or where to go.
Well, not where to go, or to get help. Yeah. So it was a really tough period in our history, and I can't pay tribute enough to people who went into midwifery, because ever since recorded history, it has been a part of our history. There's, of course, as I have read about midwifery, I understand there were 2 babies born on the Mayflower by midwives. You know.
I did not know that.
Yeah. I don't know where I read that, but I read it someplace. It's someplace, you know. But it's
It's necessary.
it's necessary.
Yeah. I also wanted to talk a little bit more about the way your work, protesting in Atlantic City, right, or working
Well,
for Tougaloo, brought attention to a problem that I guess most of America didn't care about or know about, and how bringing attention to the problem brings attention on you and makes your life more dangerous.
Absolutely. You know, I left Terry because of harassments, and didn't want to bring my parents into it, and moved to Jackson, really just down the street from where I am now, because of that. Christ, it was, you know, people calling you up, people interfering with your phone calls. But the more, really and truly, the more I was interfered with, the more determined I became. You know, I just more determined. I'm sure that was the feeling that most of us, most of the people that I got to know as a physician for the medical community for human rights, and I hadn't had, as a physician, had an opportunity to put my hand on a number of people because of my role, and because Mississippi was ground zero.
I'm pretty much out of questions for you. I just would like to bring us back around to where we started with family, and how important family is, and how important it is to share these stories with family. So I was wondering if you could talk a little bit about your family, your children or grandchildren, and what you've told them about Mississippi and the history and the legacy of healthcare.
Well, I have 3 children, and my oldest son, incidentally, I grew up in church too, but on my biological side of the family, they are preachers now, but back then there were no preachers. We just, I had to go to Sunday school, church, and growing up in a small town like I did, my family was split between the Baptist, Methodist, and Church of Christ. My mother's family followed Bishop Jones. In fact, and incidentally, half of us was baptized with my mother, and half of us was baptized with my father. I don't know how that happened. Half of us Church of Christ, and half of us Baptist. But the ironic thing is, back then, each church had a Sunday. So we all dressed up on Sunday, and it was either at the Methodist church or the Baptist church or a Church of Christ Holiness. And so I got a taste of it all. But what I was going to tell you is my wife's father was, my wife, of course, was a psychiatrist and one of the few in the country at that time. And but her father and grandfather were preachers. Her father, and I have a picture of this, was one of those prominent preachers who was called to the White House to witness Truman signing the bill integrating the armed services. And she apparently influenced, I said she apparently influenced my family, because my oldest boy declared early he was going to be a preacher, and I used to say him, "Sit down, boy, you don't know what you're going to be." Yeah, I was trying to make a doctor out of him. Everybody I came across, I tried to make a doctor out of him. And he just finally told me, he said, "Daddy, I'm going to preach." I used to take him to the office. Patients loved him. He had a good personality, and and they just loved him. And my second child, she was kind of short, and we sort of insisted that we did influence her in college, but she told us that after we had forced her into Tougaloo, we weren't going to do that for her graduate school, and guess what she ended up doing? Going to Vanderbilt.
Oh, Vanderbilt.
In divinity.
In divinity too.
Yeah. And my baby son, who was a National Merit Scholar, we tried to force him into Howard. He said, "No, I'm." He had gotten accepted at both the 3 of the Ivy Leagues, and he chose Wharton's School of Business as number 1. And he was on his way, but he died early. So I have a biological family who became physicians. Yeah.
You do have biological family?
Yeah, nieces.
Nieces?
And nephews.
Oh, that's
Yeah.
great.
Mm.
And did you teach them everything you know?
I tried. Yeah, I tried. Yeah.
Do they practice in Mississippi?
Yeah, I have a niece who is well, she's trying to retire. She's director of women's health for Central, and has been connected with UMC. Done a lot of things.
Oh, wow. What's her name?
Edith Rayford Smith.
Okay.
Edith Smith Rayford.
Smith Rayford. Well, before we finish, is there anything that I haven't asked you about that you wanted to get on the record today?
No, other than the fact that we must continue to work to make health a human right, and that in addition to that, I think we got to get politically active and make sure that health is taught from K through 12. I think that people got to become more conscious and take more responsibility for their own health.
Speaking of taking responsibility for our own health, I wonder if there's any advice you would give to Black mothers or Black women looking to be mothers.
Well, it's a long story. This is why I say you can't teach it all in a lecture. It's one of the things that we brought to the forefront. with community health centers, the social determinants of health. You know, housing, good water, good environmental stuff. Not only but environmental, mental stuff. All of those things influences healthcare. Yeah. And those are things that I think got to be taught from K through 12. You know, physiology, pathology, and all those, and how the social determinants of health influence what we become and how long we live.
Mm-hmm. You saying that makes me think of the water crisis in Jackson and how that inevitably affects health.
Absolutely. And what we eat and how we eat.
Yeah.
As an example, I don't think, you know, back in the 60s, what do you think was one of the biggest health crises we had in the state?
Diabetes?
Well, diabetes, but it hadn't gotten worse. But this is where, you know, but malnutrition. We still have malnutrition in the state, but we shouldn't have malnutrition in the state if we understood, yeah, appreciated how to make better health choices in the selection of the food and resources we have.
Well, I want to thank you so much, Dr. Smith, for being here today, for taking the time to talk to me and answer all my questions, and being such a willing participant in the Granny Midwives Oral History Project. We really appreciate it, and I really look forward to transcribing this interview and getting it back to you so that you can make sure we have every detail exactly right for the project.
Yeah, well, I'm just thankful to Albertine for doing so much. I don't think Albertine knows herself, but Miss X.C. Edwards, the late Dr. X.C. Edwards, who is incidentally a distinguished nurse who worked in every aspect of health, and the only black female in the state, on the wall of distinguished nurses at the Mississippi State Board of Health. And Mr. Jackson, who was a former principal at Smith Robinson Museum, and myself were the three people who incorporated, got that museum incorporated. And so I'm just happy that she is further endowing and showing up the importance of the Smith Robinson Museum.
Yeah. We were really happy to have the Granny Midwives exhibit at the Smith Robinson Museum. And I think Dr. Harrison's goal, you know, for her legacy was really to have the Scott Ford houses be revitalized or fixed up in a way that can also be a museum, that can also be a place for people to hear these stories. I just hope that in the meantime, while we're trying to get that off the ground, these stories being accessible at the Margaret Walker Center and accessible online allows people to learn about this history and even to learn about their own health care, like you said.
Yeah, that's where things are going to have to start, is awareness.
Well, again, thank you so much.
And thank you for the opportunity. Appreciate the opportunity.
This has been great.
Make sure Heather get this.
Yeah.
Okay, I'm stopping him.
Thank you.
No problem. Doc, I had my own question.
Mhm.
If you would